Hi, and welcome to a tour of our anatomic tissue lab. All of our anatomic pathology is done on the 4th floor of our hospital here on one side. We have all of our clinical pathology on the other, which we'll go through a little bit later. But anatomic pathology is where all of our specimens, our tissue specimens will come through that come from the OR. So they will come up as the specimen is actually, sorry about that, please come on through, no problem. As the specimen is coming up from the OR, it will come into this area where we will make sure to check it in our Epic system, get it logged in under the patient name, make sure we get a number for it, make sure that it gets all of the information that it's supposed to have, which we can check in real time about where it will go, what surgeon it was, all of that information is given. And then once that tissue comes into the lab, we want to actually take it from something very large to something very small. So in this area, this is actually where dissection happens. We have PAs and residents that come in to do that dissection of tissues. Those tissues are ready to be grossed after they have sat in formalin for a little while, and they will come in here. We have multiple different bays or stations, and this is like our desk workspace where we get everything dissected from a very large specimen down to a very small specimen that will be put on the sides. So we'll walk through and we'll show you that. We've got some dissection happening here. Paul is taking a very large specimen and actually putting the very important pieces of each of those into blocks, which those blocks will become our slides later. Once we have a block of tissue or a smaller cassette of tissue, we actually need to infiltrate that with wax. So all of the water or basically the water that's in the specimen needs to be removed. We have to desiccate that out with a series of alcohols and infiltrate that with wax to give it some rigidity so those can be cut on very small sections. This part is actually done overnight for us. It's a 2-hour for biopsies to 8-hour process to have all those tissues come out very perfectly, to arrest the tissue exactly where it needs to be after it's fixed, and to get it ready for cutting. On this side of the lab, we have all of our histology, our immunohistochemistry, and all of the other additional stages once a tissue has been processed and is going to be cut for slides. In our histology lab, that small piece of tissue is actually put into slides, which Justin is using on a microtome right now. He takes each piece, cuts it into 4 micron sections, labels those, and those are what will go out to be read for diagnosis. We also utilize scanning for a lot of our slides if you cannot be actually here in person, either to do consults or currently, as we have some people off campus, we can actually put slides into our slide scanner and send those out for consultation. And it's used very much the same way an electronic microscope is used. So we get to use a lot of cool technology here as well. Now, if you actually need a diagnosis in real time, if a surgeon needs something that may or may not change their surgical procedure, and they need to know whether a lymph node is positive or whether a margin is positive, this is our frozen section room where a pathologist will actually come and in real time, in a 20-minute turnaround, read out a specimen. We do frozen section diagnosis there at a different type of cutting station, but it's very similar in its in the way that it works. We don't actually infiltrate with wax, but those slides can still be cut, and this image can then be sent not only to everyone in the room, but we can showcase this and send it into the OR room and show exactly what we need to showcase for the diagnosis there as well. So that's the basics of how tissue comes in, how it gets cut, how it gets processed, how we make slides for it, and how we get diagnoses out both in a rapid time and in normal time.